I hope you will accept my apology on behalf of the Secretary of State, as he is self-isolating. Mr. Speaker, before...
Just on that point, just to say, I really do appreciate the Minister is so courteous, but it's a bit... makes it worse when the Minister is actually at the dispatch box when all this is going outside, and to turn to the House and say, well, I can't tell you, not that I don't know, but I can't tell you, is even more worrying. Sorry about that.
The Speaker makes a very powerful point. Mr. Speaker, before I turn to my remarks today, I wanted to say something to you, sir. I want to take a moment ahead of this House rising for the summer to thank you, sir, and everyone who works here in Parliament, your whole team, for everything you've done to keep us all safe over the past few months. The fact that we've kept our democracy running and running safely at this time of crisis is an incredible achievement, and we're all extremely grateful to you and your team. Mr. Speaker, with permission, I'd like to make a statement on the COVID-19 pandemic. This week, we've taken a decisive step forward, taking step 4 on our roadmap and carefully easing more of the restrictions that have governed our daily lives. But although we're moving forward, we must remember that we move forward with caution, because this pandemic is not yet over. The average number of daily cases in England is around 41,000, and hospitalisations and deaths are rising too, although at a much lower level than we had this, if we had this number of cases during previous waves. So even as we take step 4, we're urging everyone to think about what they can do to make a real difference. And today we're launching a new campaign, encouraging everyone to keep taking the little steps that have got us this far, like wearing face coverings in crowded public areas, making sure rooms are well ventilated, and getting rapid, regular tests. We're also supporting businesses and organisations, helping them to manage the risk of transmission within their venues, including through the use of the Nhs Covert Pass for domestic use. I know that this has been of great interest to honourable members, and I wanted to use this opportunity, Mr. Speaker, today to reiterate this policy and offer the chance for the House to have its say. Mr. Speaker, this week, after a successful trial, we have rolled out the Nhs Covert Pass. This allows people safely and securely to demonstrate their COVID status, whether it's proof of vaccination status, test results, or natural immunity. Anyone can access a pass via the NHS app, the NHS website, or by calling 119 and asking for a letter to demonstrate vaccine status. People will also be able to demonstrate proof of a negative test result. Although we don't encourage its use in essential settings like supermarkets, other businesses and organisations in England can adopt the pass as a means of entry where it's suitable for their venue or premises, and when they can see its potential to keep their clients or their customers safe. But for proprietors of venues and events where large numbers are likely to gather and likely to mix with people from outside their households for prolonged periods, deploying the pass is the right thing to do. The pass has an important role to play in slowing the spread of the virus, and so we reserve the right to mandate its use in the future. Next, Mr. Speaker, I'd like to update the House on vaccination as a condition of entry. We all know the benefits that both doses of a vaccine can bring. Data from Public Health England estimates that 2 doses of a COVID vaccine offers protection of around 96% against hospitalisation. And today, Mr. Speaker, we have new data from Public Health England that estimates the vaccination programme in England alone has prevented 52,600 hospitalisations. That is up to 6,300 from 2 weeks ago. A fitting example, I'm sure you will agree, sir, of the protective wall that our vaccination programme has given us. A wall that's getting stronger every day. It's this protection that's allowed us to carefully ease restrictions over the past few months. But we must do so in a way that's mindful of the benefits that both doses of the vaccine can bring. This strategy, this philosophy, has underpinned our approach over these critical next few months. This week, as part of our Step 4 measures, we allowed fully vaccinated adults and all children to return from amber list countries without quarantine, with the exception of France due to the persistent presence of cases of the Beta variant. From the 16th of August, children and under 18 and people who are fully vaccinated will no longer need to self-isolate as contacts, given their reduced risk of catching and passing on the disease. And as I updated the House on Monday, at the end of September, we plan to make full vaccination a condition of entry to those high-risk settings where large crowds gather and interact. By this point, everyone aged 18 and over will have had the chance to be fully vaccinated, and so everyone will have that opportunity to gain the maximum possible protection. So, as a condition of entry to these venues, people will need to show that they are fully vaccinated, and proof of a negative test will no longer be sufficient. This is not a step that we take lightly, Mr. Speaker, but all throughout this pandemic, just like governments all across the world, whether it's Singapore or Australia or Germany and France, we've had to adapt our approach to meet the threats of this deadly virus. And this is no different. But we will always keep these measures, like all our measures, under review with the goal of returning to the freedoms that we love and cherish. Mr. Speaker, we should all be proud of the enthusiasm and uptake we've seen for our vaccination programme. 88% of all adults have now had a first dose, and 69% of all adults have had both doses. And this uptake means the latest ONS data shows that 9 in 10 adults now have COVID-19 antibodies. But there are still many people who are unprotected, including 34% of people aged 18 to 29 who have not had either dose. So I'd like to once again, ahead of the summer recess, urge everyone to come forward and get both doses to protect yourselves, protect your loved ones and your community. Our battle against this virus, Mr. Speaker, is not the kind of battle where we can simply declare victory and move on with our lives. Instead, we must learn to live with the virus, doing whatever we can to slow its spread while we maintain the vital defences that will keep us safe. And that is exactly what this government will do, and I commend the statement to the House.
We now go to the Shadow Secretary of State, who is virtual, a virtual Jonathan Ashworth.
Well, thank you very much, Mr. Speaker, and thank the Minister for advance sight of his statement. But let's be frank, it was a shambles yesterday, and it was an insult to the House, and it was a letdown for health and care staff. Ministers have been dragged kicking and screaming to this 3% settlement. And can he accept, and does he accept, that it isn't an NHS-wide pay settlement because it doesn't cover all the health and care workforce who don't fall under the pay review body? It doesn't cover, for example, our junior doctors who have had an intense year caring for sick patients on ventilators who have been redeployed to other sites across the NHS, have seen their training disrupted. So will the junior doctors get a pay rise, especially given that the pay review body, in paragraph 10.36 of its report, urges ministers to recognise the role of doctors out of scope? Will all health staff who work in public health receive the settlement? And yet again, even though care workers are obviously not covered by this pay review body, we know that our care workers are so valuable. Will care workers finally get the real living wage that they deserve? And how will this pay settlement be funded? NHS trusts don't even know what their budget will be beyond September. Now, the Health Secretary has just said the pay settlement costs 2.2 billion. So where is the 2.2 billion coming from? Or is he expecting trusts and general practice to find it from their existing budgets? And at a time when the NHS is in a summer crisis, where we've seen COVID admissions increasing, where there's more patients on ventilators in hospitals now, when we see operations being cancelled again and waiting times growing because of the pressures that the NHS are under, rather than getting a funded settlement for the NHS, we've seen this week briefing and counter briefing from the Health Secretary, the Chancellor, Downing Street about what may or may not be coming for health and social care. But the NHS needs more investment now to cope with the pressures that it is under. So can he confirm that the government are going to break their manifesto pledge to increase national insurance? Or is the Business Secretary correct to say this morning, I don't see how we could increase national insurance? Because the Prime Minister promised on the steps of Downing Street 2 years ago this Saturday that he would have a social care plan. But this isn't a plan for health and social care. It's a government in disarray, which now brings me on to the so-called pandemic with the problems with isolation. But the problems with isolation we are seeing is a symptom of what happens when ministers allow infections to get out of control. Now, the government are apparently U-turning today and agreeing a list of workers who could be exempt from isolation based on a negative PCR test. Well, with infections running at more than 50,000 a day, possibly on the way up to 100,000 a day, can he absolutely guarantee that PCR testing capacity will be available to cope with the inevitable increased demand this summer? And if he wants to avoid shutting society down, he needs to bring infections down. So why have the government ruled out extending statutory sick pay for the lowest paid? And what is he doing to drive up the vaccination rates amongst younger adults? Because he will know that allowing infections to rise amongst this cohort sets his vaccination program back, given that somebody has to wait 28 days post-infection for vaccination. Now, today he's repeated his support for vaccine passports. So can he explain why he thinks it's safe to go out clubbing to the early hours this Friday, but in September it's only safe to go out clubbing if everybody is double jabbed? Can he confirm when the relevant statutory instruments will be laid and when the vote will be on introducing these passports? Now, he has a proposal for nightclubs in September, but does he have a proposal for schools in September? Because 1 million children have been off school recently. So as we asked him on Monday, will he use this summer to install air filtration units in schools in time for September? And is he considering bringing mask wearing back in schools as well? And finally, Mr. Speaker, can I, like the Minister and others across the House, thank you and all the staff especially for the extraordinary work that you have put in these last 12 months to ensure our smooth running of Parliament in these most unprecedented of circumstances. And I hope you all are able to have a suitable rest over the summer recess.
Minister.
Thank you very much, Mr. Speaker. The honourable member asked the question about who is included in the 3% pay rise that has been recommended by the independent review body. It is 1 million NHS staff, including nurses, paramedics, consultants, and of course salaried GPs as well. The junior doctors that he speaks about have got a separate multi-year pay rise over 3 years amounting to 8%. He asks about the capacity for testing, and I looked at this, Mr. Speaker, before coming to the House, and the capacity currently for PCR tests is not 600,000 a day, it's actually 640,000 a day as of the latest data I looked at. He asked about schools. There will be 2 supervised tests for schools. He will know because at the Monday statement we announced our acceptance of the JCVI guidelines on vaccinating vulnerable children, vaccinating children who live with vulnerable adults, and of course those who are 17 but within 3 months of their 18th birthday. And the JCVI will keep under review the vaccination of healthy children as more data becomes available from countries like the United States of America and Israel. He asked the question around the COVID vaccination pass and nightclubs and other crowded unstructured indoor settings such as nightclubs and music venues, or large unstructured outdoor events such as business events and festivals, or very large structured events such as business events, music and spectator sport events. They are the ones that we are most concerned about. We've seen in other countries, whether it's in Holland or in Italy, the opening of nightclubs and then having to reverse that decision rapidly. So what we're attempting to do, the reason we have the COVID vaccination pass in place, is to work with industry in this period whilst we give people over the age of 18 the chance to become double vaccinated. It would be hugely, I think, unfair to bring in that policy immediately. Giving people until the end of September is the right thing to do, whilst at the same time allowing those businesses to open safely using the app now, because the app went live and is very much something that the industry is engaging with. Mr. Speaker, I just want to really sort of address the House on, there are no easy decisions to anything we have had to take with this virus. This is the one thing that we have learnt about this virus. The most effective tools we have against the virus is, of course, the vaccine programme, followed by the tool of self-isolation. So if we want to get back to normal and get our lives back, we need to transition this virus from pandemic to endemic status, from pandemic to manageable menace status, as we quickly and safely as possible deliver that. If we release all restrictions now, we risk, of course, including restrictions around isolation, which I know a number of colleagues will, I'm sure, ask about today, we risk the number of infections, which he worries about, as I do, rising rapidly. That could risk the transition of this virus at this time. We're working flat out with industry, and I commend companies like Lidl, who know they're under pressure, but will work through it with us, and of course critical and frontline and key workers to allow people to be able to take a negative test, as I announced on Monday, for frontline health and social care workers, and then get back to work. And of course by the 16th of August, everybody who's double vaccinated will be able to do that.
Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. May I start by wishing you and your family a ping-free summer, and also thank you for upholding the values of this House over the last few months. The Minister of State will have heard of an organisation called YouGov, who this week said that 1/10 of the people who have the NHS COVID app have deleted it, and a further 1/5 are considering doing so. Given that he made his living from listening to public opinion, does he not think it's time for the government to listen to public opinion and scrap the 10-day isolation requirement immediately for people who are pinged who have been double jabbed, in favour of having to get isolated until they have done a negative PCR test? Otherwise, we risk losing social consent for this very, very important weapon against the virus. And with your permission, Mr. Speaker, I would just like to briefly ask you about the issue we were not able to ask ministers about in the House yesterday, which is the decision on NHS pay. I support the decision to accept the pay review body recommendations. It's the right thing to do, but it costs £1.5 billion. Could the Minister confirm this will not be paid for by cuts to other parts of the NHS budget? And if it's going to be funded through what the Times say today is this new national insurance rise for health and social care, will he confirm that the funding for social care would be ring-fenced in that situation, so we do not have the situation where social care once again loses out because of pressures in the NHS?
I wasn't responsible when you said you, for the decision yesterday. Minister.
Thank you very much, Speaker. Let me take those questions in reverse and thank the Chairman of the Select Committee for his always diligent and thoughtful questions. As he will know, we gave the NHS in England an historic settlement in 2018, which will see its budget rise by 33.9 billion by 2023-24. We've provided over 27 billion to support the NHS in England since the start of the pandemic, including 9.7 billion so far for 2021-22. We'll continue to make sure the NHS has everything it needs to continue supporting its staff and providing excellent care to the public throughout the pandemic and beyond. And he asks specifically about social care. I know that the Secretary of State and the Prime Minister are committed to making sure that we deliver on that social care promise we have made by the end of this year. His question around the data and, of course, public compliance. Public compliance is incredibly important, and I want to thank each and every person who, one, has come forward and got themselves protected. We've seen over the last few days almost doubling of people going onto the NHS website to look and book appointments, almost doubling of appointments as well, which is incredible considering where we are at the moment, i.e. with almost touching 90% of all adults. These hard yards, people are still coming forward. There are no easy decisions. I said this, I think, in answer to the Shadow Health Secretary around this. We know that our most effective tool is the vaccination program, but the second most effective tool is self-isolation. What we are attempting to do is transition this virus from pandemic to endemic status. If you allow all these things to happen too rapidly and people then decide not to self-isolate, then I think you run the risk of infection rates running away with us and challenging the strategy of transition, being the first major economy to transition. So we are working with business. We're working flat out with the frontline critical infrastructure, with key workers to get that guidance out, and colleagues in this House, I'm sure, will be the first to receive that guidance. I will make sure of that, even during recess.
Let's go to SNP spokesperson, Dr. Philippa Whitford. Philippa.
Thank you very much, Mr. Speaker, and I'd like to wish yourself, colleagues, and all the House staff a safe and happy summer recess. It's clear that vaccination is critical to fighting this pandemic. So while we all need to encourage uptake among younger adults, is the Minister in a position to guarantee sufficient supplies of Pfizer or Moderna vaccines to vaccinate them before the end of September? Whether legally, as in the case of care home staff, or through excluding people from social activities, does the Minister recognise that making vaccination mandatory can increase distrust among those who are hesitant and actually drive them to become outright vaccine refusers? Despite the talk about caution, COVID cases in England were already surging when the government ploughed ahead with lifting all legal restrictions on Monday. While vaccination has reduced the hospitalisation rate to between 2 and 3%, the Secretary of State himself suggested COVID cases could soar to 100,000 a day, which would result in 2,000 to 3,000 admissions, similar to the first wave. So does the Minister really not recognise that would put health services under enormous pressure and cause the patient backlog to grow further? Is the government even considering the impact of uncontrolled virus spread on vulnerable people, the incidence of long COVID, or the risk of generating yet another variant with even greater vaccine resistance than Delta? And finally, what contingencies are being put in place in case during recess the government need to reintroduce COVID restrictions, as has happened in Israel and the Netherlands?
Minister.
Thank you very much, Mr. Speaker. The Honourable Lady makes a number of important points, especially her final point, reminding the House, as I did in my statement, that a number of countries have had to open up and then reverse some of their decisions, which is why we're being very careful to ensure that this transition step 4 and then transitioning the virus from pandemic to endemic status is as successful as possible. She asked about children's vaccination. She will know because the Scottish Health Minister, Mr Humza, has, as the Welsh and Northern Irish, and of course ourselves in England, accepted the JCVI guidelines of vaccinating vulnerable children, children living with vulnerable adults, and those approaching their 18th birthday. And if the JCVI go further, as they are reviewing more data on vaccinating all children, then I assure her that we have the supply available of Pfizer and Moderna to undertake that, whilst we also continue to deliver on the double vaccinations of all adults by the end of September. She asked about the immunosuppressed. Of course, against guidelines have gone out in terms of the precautionary measures that immunosuppressed people would take, similar to the rest of the country, to be careful, to wear masks in crowded indoor spaces, of course, ventilation as well. And the JCVI has gone further in our interim advice from the JCVI for the booster campaign. They've placed the immunosuppressed at the top of the priority list for the boost campaign, which will begin early September. That is the operational target that we are working to begin boosting, and of course to co-administer wherever possible the flu vaccination.
Thank you, Mr. Speaker. Given the massive opposition that there is amongst those who operate nightclubs and events, the decision of the government to make their introduction of COVID identity cards voluntary is probably a sensible one. But can I explore with the Minister what he means when he says we reserve the right to mandate their use in the future? We might have hoped, Mr. Speaker, that the right that the government sought to reserve was the right to seek the permission of this House to make their use mandatory in the future. I hope that this was just a small piece of ministerial arrogance that led the Minister to misspeak, but I would like his assurance that we will be given the opportunity to express a view on this before mandatory use of COVID identity cards is introduced. And last week, I asked the Secretary of State for Health a whole range of questions about the practical consequences of this voluntary scheme. I asked what constituted large events, who would be the judge of what they were, what was meant by encouraging businesses, and what would be the consequences for any businesses that resist the encouragement from government. The Secretary of State for Health had no answers to these questions. Will the Minister today answer the questions, if not necessarily for the benefit of the people in this House, then at least with a bit of respect to those who operate nightclubs, big events, restaurants, bars and others who have absolutely no idea what is going to be required of them?
Minister.
Thank you, Mr. Speaker. And it is unlike the member for Central Ayrshire to accuse any colleague of being arrogant, and I certainly hope that I didn't come across as such. He's always courteous and polite, and I've certainly found him over the years. He asks several important questions. In terms of reserving the right, of course, the government will come back to the House if the decision is to mandate the double vaccination requirement for, as I've outlined in earlier response, nightclubs are crowded, unstructured indoor settings, large unstructured outdoor settings, and of course the very large events such as business, music or spectator sports events. In the meantime, we would encourage the use of the Nhs Covert Pass in facilities or events where people are likely to be in close proximity to large numbers of people from other households. We're working with the sector. Indeed, the Minister for Business, Mr. Scully, met with the sector yesterday, again, as he does regularly. The sector itself would have seen what happened in other countries like the Netherlands. And I think it's in the interest of all of the sector and businesses to want to reopen and reopen permanently, not have to open and close and open and close. Hence why what we're doing is working with the sector in this period and, of course, giving people a chance to get their double vaccinations by the end of September.
Much, Mr. Speaker. Just on that last point about the decision, by the way, the statement's very clear. It says the government has decided we plan to make full vaccination a condition of entry. So my reading of that is the decision's been taken, so the government needs to come to the House to ask the House's permission to legislate. The Right Honourable Gentleman was exactly right. But can I ask the Minister about the pingdemic? We've just had the data for last week. Over 600,000 people using the app were told to self-isolate. Now, the Minister set out clearly that on the 16th of August, the right way of proceeding is that those who've been double vaccinated will be asked to take, will be advised to take a PCR test, and if that's negative, then they'll be able to go about their business, reflecting the reduced risk of them being infected and therefore passing on the disease. In a discussion this morning on the Today programme, the Business Secretary was told that businesses in a key sector were operating in that way now with the advice from the app. And he was asked whether that was appropriate and safe. He said it wasn't. Now, if it's not safe, I think it is safe. It's the government's policy for 16th of August. If it's not safe now, how does it suddenly become safe on the 16th of August? And given it is safe on the 16th of August, because that's the government's policy, can we not just implement it now? The danger is large numbers of people will either delete or stop listening to the app, and then when we get to the 16th of August, they won't be getting the advice to take a PCR test, and we'll have actually made ourselves less safe and less well protected. So I urge the Minister to think again, bring it forward now. People will then be taking tests where they're advised to. Otherwise, I think people will simply stop listening, and that's very dangerous for public health.
I'm grateful for my honourable friends, right honourable friends, excellent interventions as always. Challenging, but nevertheless the right challenge to think through. I refer to my answer earlier around there are no easy decisions, and what we are attempting to do, and probably one of the first nations, certainly the largest economies in the world, that will see, I hope, our transition of this virus from pandemic to endemic status, to manageable menace from pandemic, is through our vaccination programme as our primary tool. But actually, the second most effective way is to make sure people do self-isolate. I take on board his point and the point made by the Chairman of the Health Select Committee, which is why we're working flat out with critical infrastructure, with key workers, of course, with frontline NHS and social care staff, which I announced on Monday, to make sure that people have that ability to test and then PCR test and then follow up a week or up to 10 days of daily lateral flow testing instead of self-isolation for 10 days. There are no easy answers, is the honest truth. I tell him this because the very clear clinical advice and the evidence is that if we don't do this carefully and slowly, then we could risk the transition of this virus. On his question around the requirement around nightclubs by the end of September, I'll give him this assurance that, of course, we'll be coming back to the House to make sure that the House has its appropriate say on the matter. But it is something that I think, as we've seen with this virus in other countries, is the right thing to do.
Jim Shaw.
Mr. Speaker, can I thank the Minister for his statement today and for all that has been done for the COVID-19 vaccine rollout. Recent news from the Northern Ireland Assembly Health Minister states that at the end of July the closure of mass vaccination centres, for example the SSE Centre in Belfast, will come into force. The Minister has taken this opportunity, the Minister here in this House has taken the opportunity through the press today to urge people one last time to get the vaccine. Can I ask the Minister, has he come to an assessment on the closure of mass vaccination centres in England, given the clear success of the vaccination process? And if we're mindful of this autumn, we will be doing a COVID-19 vaccine booster process as well, and that, along with the flu, will, I would suggest, add pressure to the health system. And will the Minister ensure that there are options in place, for example, pharmacies and community centres, that will be there to bridge the gap? Thank you.
Thank you very much, Mr. Speaker, and I thank the member for Strangford for his excellent question. He's absolutely right. We are preparing a pretty ambitious vaccination programme beginning early September for the COVID boost. According to the interim advice from the JCVI, now that could adjust as more clinical data comes through from the trials, from the COVID boost trials that we're currently conducting. And of course, wherever possible, we will co-administer flu vaccine at large scale. Again, my big concern is that we have not had much flu circulating in communities, and we could be in a position where in a bad flu year we could lose 20,000 plus people, hence why our ambitions are equally high for flu. We will look to co-administer wherever possible. We're looking to raise the number of pharmacies as well. We currently have over 600 pharmacies in the COVID vaccination infrastructure, as well as, of course, the brilliant primary care networks, the hospitals and the vaccination centres. So the COV boost and the flu will be equally ambitious, and we look at the whole infrastructure and how we utilise it, as well as, of course, making sure that GPs are also able to get back to doing the work they need to do, which is looking after their patients.
As has been mentioned, I am seeing in Hyndburn and Haslingden in my age group there is a hesitancy to take up the vaccine. So can I ask the Minister what work is being done with local authorities to target these groups and alleviate their fears, because the only way out is a vaccine, and we really need to get that message across.
I'm grateful for the honourable member for Hyndburn for her excellent question and her work in her constituency to highlight the benefits of being vaccinated and fully vaccinated. The work that has gone on in Hyndburn is tremendous. What we're doing with local government is to make sure that the NHS has the flexibility to launch whether it be pop-up sites or increasing the hours of vaccination during this period of Eid celebration, to look at how we encourage more of our Muslim fellow citizens to come forward and get vaccinated, and of course lots of messaging and just pointing to where people can get information, different media, hyper-local media, as well as, of course, some of the media that I think her generation will be more familiar with than mine, including TikTok and social media and influencers and YouTubers. That is all happening at scale, and it's great to see in the last couple of days the number of appointments booked has doubled on the national booking system, almost doubled I should say, but also the walk-in centres. People can just walk in without any appointment and get their jab.
Thank you, Mr. Speaker. May I also add my party's thanks to you, House staff, and to everyone across these islands who has worked so hard to save and preserve life during the pandemic. I want to pick up on a vital component which I believe the government needs to give great attention to, in terms of vaccination. And it will not have escaped the Minister's attention, and anyone who's attended the regular briefings that we've had around this virus will have seen in Professor Van Tam's heat maps the distribution and the upward spread of the virus, where it seeds in the younger population and exponentially grows up through the ages. And I really want to ask his opinion on why he thinks the JCVI are being extremely cautious in extending vaccination into the 12 to 17-year-olds, given that the CDC have now been vaccinating that population in the States with some concerns, but I think manageable numbers of concerns, and why we are not progressing more vigorously to vaccinate that population, and it's only limited to those with underlying health concerns or related to those with underlying health concerns. And there's a fundamental advantage there, because it will increase their well-being, it will improve their access to schooling after the holidays, but more importantly, it acts as...
Order. We've got to be, if we can, nobody else is going to get in today, and that's not fair to other members. They've got to be short questions in the statement. I hope you're going to finish in a second.
I will finish now, Mr. Speaker, and I apologise. Does he not see the advantage in delivering those vaccines now, and what do we do if we decide that that needs to go live during recess?
I'm grateful for the member for Kirkcaldy and Cowdenbeath's question, a very important question. The JCVI are constantly reviewing the data from other countries who are vaccinating all children, 12 to 15 years old. Their concern has been centred around vaccinating healthy children. There's this very rare signal on myocarditis on first dose, and they are awaiting more data on second dose, and of course they will continue to review that, and will come back to us, and of course we will come back to the House.
Martin Vickers.
Thank you. In North East Lincolnshire, the infection rate has been hovering around 1,000 per 100,000 now for the last couple of weeks, which is of obvious concern to my constituents. I'm in regular touch with the Northern Lincolnshire and Goole Hospital Trust, who are doing an excellent job. But could the Minister reassure my constituents that if additional resources are required by the Trust, that the Department will provide them? And one other request from the Trust management is that they've had a big expansion of demand on A&E over the last few days. Could the Department step up the campaign to encourage people to use the 111 service?
I'm grateful to my honourable friend's question. I think in his constituency of Cleethorpes, they have now done 122,397 cumulative total of doses, which is a tremendous, tremendous achievement. I will absolutely take away his request and we'll come back to him once I've had a chance to discuss it with NHS England.
Thank you, Mr. Speaker, and I must thank the Minister for our Friday mornings together. Not just me, but every member of this House is grateful for the weekly fixture highlight Zoom Fest. Is he aware that there are already glitches in the shiny new NHS COVID passport he mentioned? Constituents are reporting, Connie and Charlie, two of mine, they've been going for a year for Novavax trials, and now they're being treated as if they're vax deniers, the text they get from the NHS, and they're grounded. And plus, another guy, Carl, returned to his native US to have his 2 jabs because he's not eligible for NHS treatment. He says that it's xenophobia, that he can't access events that Brits can. I'm sure it's unintentioned. People think they're being punished for doing the right thing. Will he rectify?
Thank you, Mr. Speaker, and I am really grateful to the member for Ealing and Central Acton for that excellent question. And I'm grateful for her comments about our Friday morning meetings. Her constituents can rest assured those who are in clinical trials, including the Novavax trial, will have their data on the NHS COVID app as being fully vaccinated, whether they are receiving the placebo or the vaccine across all trials, and that is happening. And I will take that offline to look at their case to make sure that happens for them, because I'm assured that the system already recognises that in terms of UK nationals who have been vaccinated overseas, by the end of this month they'll be able to talk to their GP, go through what vaccine they've had, and then have it registered with the NHS as being vaccinated. The reason that for the conversation with the GP is to make sure that whatever vaccine they've had is one approved in the United Kingdom, but also is one that ultimately will be a coordination between WHO, ourselves, the European regulator and the US regulator and other regulators around the world, because we're working at speed. At the moment, it is UK nationals and citizens who've had UK vaccinations who'll be able to travel to amber-list countries other than France and come back and not quarantine. We want to offer the same reciprocity as the 33 countries that recognise our app, and that will happen also very soon.
Congratulate the Vaccines Minister for working his socks off over the last year and doing such a tremendous job in vaccinating the nation. In Northamptonshire, the vaccine rollout has been a tremendous success, with between 90% and 100% of each of the 5-year cohorts above age 50 receiving both jabs, and over 67% of 18 to 24-year-olds already having received their first dose. Will the Vaccines Minister join me in congratulating all the professionals and volunteers locally who have made possible this tremendous local success?
Thank you very much, Mr. Speaker, and I thank my honourable friend, the member for Kettering, for his work locally and taking that local leadership, like many colleagues have done, to get the message out that vaccines are safe, vaccines are our way out of this pandemic. And of course, I will join him in congratulating the whole team, the professionals and the volunteers, in the tremendous effort they've made. I think the figures I have is 124,042 in the Northamptonshire STP. Numbers are even tremendous, even amongst the 18 to 24-year-olds. They're leading the way at 67%. We want to get that number even higher as quickly as we can.
Mr. Speaker, and can I welcome the Minister's acknowledgement that the virus is now endemic, as indeed has the Government of Singapore. Unfortunately, government dither around this may have scuppered the vaccine pass. But has he had any indication from its diverse opponents as to how the country can otherwise take a risk management approach rather than risk avoidance that has led, for example, to the pingdemic? Or on the other side, the Wild West approach advocated by some on his own side, leading to a possible further lockdown? Can he also indicate whether the Treasury are actually engaged in this debate on the side of the economy and public finances, or are they still in yellow submarine mode, disappearing under the waves?
I'm grateful for the Honourable Member's question, Mr. Speaker. I would just remind him that the Treasury have put £407 billion to work to shelter the economy and people's livelihoods and, of course, protect jobs. He raised a number of important questions about looking at other countries. And I think, as I said earlier, these are all difficult decisions, but I think we're making the right, cautious decision as we transition, I hope, and see this virus move from pandemic to endemic status.
Chris Green.
I was wondering if my honourable friend would give me a better sense of the scope of how the COVID ID cards may be used in the future. So would it apply to the London Marathon? Would it apply to political gatherings, that you'll need an ID card to attend a political gathering, whether it's supportive or in opposition to the government? And could he rule out now, please, that this will not be used in educational settings, whether sixth form colleges or universities? That should be excluded because the focus now is on young adults, and it shouldn't be a passport to education or a denial of education.
Thank you, Mr. Speaker. I can certainly give him that last question and give him the assurance that in education or any public buildings this will not be applicable. As to things like the transport system or essential retail, that is our very strong commitment. Look, I keep repeating this message. We know what we need to do, and part of what we're learning from the data here and around the world is try and work with industries like the nightclub industry, like the sports bodies, to make sure that we reopen fully as safely as possible and continue to be open. The worst thing for any industry, for any sport, is to open and then sadly have to shut down again, as people have seen around the world.
Owen Thompson.
Thank you, Mr. Speaker. I listened very carefully to the Minister when he was saying how events where large numbers are likely to gather together, mixing with people from outside their own household and deploying the pass would be the right thing to do. Given that situation and making sure that we are keeping in step with the public, is it the intention of the government that this would apply, or potentially even reserve the right to mandate that this place would have to adopt the pass going forward? Or is this another example of us and them?
I'm grateful for the member from Middle Lothian's question, and I think, as I've in answer to the previous question, I said in public buildings such as this place, and of course in essential travel and of course essential retail, then that will not be applicable. That is very clear.
Let's go to Dr. Andrew Morrison. Andrew.
22,000 people died from seasonal flu in 2017-18, and modelling suggests that this year's season will start early, be severe, and will affect younger people than COVID, a demographic that tends to go to mass events. So have the government also been considering mandating proof of flu vaccination? And can the Minister ensure that vaccination records are transportable between the NHS records of each of the home nations, which is not the case at the moment, to the huge frustration of those seeking second jabs or anticipating the need for proof of vaccination that he has confirmed today?
I'm grateful for Dr. Murrison's question, and also what he has done during this pandemic in vaccinating and protecting people and helping with the vaccination, the COVID vaccination programme. He raises an important question around flu, which I addressed earlier. I am concerned about the flu season, which is why we are being ambitious and looking to co-administer wherever possible. The operational plan is to go early September, for both COVID boost and the flu campaign. But he will also know that flu is not in the category of the COVID in terms of it is endemic. We're hoping to transition COVID towards where flu is at with an annual vaccination programme. So it's a very different virus to deal with.
Let's go to Barbara Keeley. Barbara.
Thank you, Mr. Speaker. On the vaccine rollout, I'd like to ask for prioritisation of two groups. Firstly, for unpaid carers to be prioritised for boosters in the autumn, as JCVI has not put them on the priority list, but they were put in cohort 6 for earlier vaccines. Secondly, can I join my honourable friend for Ealing Central and Acton in asking for a solution to be found for the wonderful volunteers on the Novavax vaccine trial, who now find themselves not able to travel as they cannot get a vaccine certificate and their vaccines are not recognised in the EU. So, Mr. Speaker, can the Minister tell us if he will prioritise boosters for unpaid carers to ensure they're fully protected this autumn and enable vaccine certificates for those trialists who have received live Novavax vaccines?
I'm grateful for the honourable member's question, Mr. Speaker. On the Novavax trial participants, they will have their vaccine pass in the United Kingdom, and of course we're working with other countries to make sure that that is recognised. But as far as the UK is concerned, they will be considered as fully vaccinated whether they've had the placebo or the vaccine. On her very good question on the booster campaign, the JCVI's interim advice is that phase 1 is what would have been sort of the old 1 to 4 categories plus the immunosuppressed, and then phase 2 would be the 5 to 9, which would include in category 6 those unpaid carers as well.
Can I just say to everyone who's left, if we really are short and quick on answers and questions, I'll get everyone in. If not, we're due to actually finish now, but I'm going to give it a try. Jason McCartney.
Thank you, Mr. Speaker. Will the Minister join me in thanking Sylvia, Fahad and all the fantastic local team who have vaccinated over 47,000 people in Honley, Slathwaite and other pop-up sites across Kirklees? But can the Minister, though, also just confirm one of the questions they're being regularly asked, the rationale of the JCVI guidance that there should be an 8-week minimum interval between jabs?
I would certainly join my honourable friend in thanking Sylvia, Fahad and all the local team on the extraordinary work they've done. The JCVI advice on the 8-week interval is based on real-world data that suggests actually that offers the highest level of protection in terms of antibodies and T cells for people. Anything below that, and I know a number of colleagues here have asked me this question, would not be advisable.
Let's go to Vicky Foxcroft. Vicky.
Thank you, Mr. Speaker. Ministers should be aware of the fears of immunocompromised people. And unlike the Health Secretary, I know the Minister is aware of the Octave study. Does he know when this will be published? And can we have some plans for antibody testing? Immunocompromised people need to be allowed to make informed decisions. And has a ministerial directive been issued to JCVI to investigate this? And if people are seen to have low protection, what extra support are the government looking to deliver for them?
I'm grateful for the honourable member for Elizabeth Deptford's question. She knows that she and I discussed this on the Friday morning, means there is Octave and Octave Duo as well, and I know Octave is imminent to report, and I will share that data even when the House is in recess with colleagues on our group that I will make sure happens as soon as we receive that data. We want to make sure that people are protected. There's some very encouraging data from Public Health England on the immunocompromised with 74% protection for some, not all, after 2 doses. But she's quite right to point this out. We look to vaccinate and protect them with a 3rd dose, a booster dose, as the top of Group 1, Phase 1, as well in September.
Let's go to Richard Graham. Richard.
Mr. Speaker, thank you. Nobody underestimates the huge challenges the government faces or the great success of the vaccination programme. But Does the Minister recognise the frustration by the many hundreds of thousands who've been double dosed, pinged, self-isolating and following the guidelines to learn of the data earlier shown that suggests how many people are actually turning off or deleting the NHS app, and ministers reportedly advising businesses that this is only guidance? Does he not share my view that surely what is right on the 16th of August for the double dosed is right now? And would my honourable friend agree to consider implementing this as soon as possible so that businesses don't have to close, the hospitality sector suffer, and many of us self-isolate unnecessarily?
Thank you very much, Mr. Speaker. My honourable friend, the member for Gloucester, makes a very powerful point, as he's made to me many times. It is important clinical guidance to people. It is important that people take personal responsibility and corporate responsibility, as we're seeing with some great companies like Lidl, who are coming under pressure at the moment because staff are having to self-isolate. As I said earlier, there are no easy decisions on this, but to be able to transition this virus from pandemic to endemic, we just need that careful, a little bit more time until the 16th of August, not long to go, where everyone who's double dosed can have the ability not to have to self-isolate for 10 days.
Bill Esterson. Bill.
We all know a negative test is a crucial risk indicator. NHS staff off work, restaurants and pubs forced to close, empty supermarket shelves. This is a time-critical problem in essential parts of society. So when is the government going to publish a list of sectors where staff can use a negative test result so they can go to work now? Making employers apply for an exemption is simply not going to be enough. And the economy and society simply can't wait until the 16th of August.
Mr. Speaker, in the interest of time, I think I've addressed this question fully. Suffice to say, where I would gently disagree with the member for Sefton Central is that actually society came together, and we saw that with the vaccination programme, with 80,000 vaccinator volunteers, 200,000 volunteers. People are doing the right thing, as are corporates as well. We're working flat out, both in terms of critical workforce, critical infrastructure, frontline, and that we announced on Monday for NHS and social care staff.
Vaccination programme, but a number of my constituents have received the AstraZeneca vaccine from batches made in India, which isn't recognised by the European Medical Agency. So will my honourable friend reassure those constituents that they will be able to travel to Europe in France and Italy, for instance?
I'm grateful to my honourable friend, the member Southend West, and his championing of his constituents' concerns. He's absolutely right to raise those, although what I would say to him is that the European regulator recognises all vaccinations of AstraZeneca Oxford in the United Kingdom and recognises our pass. France have now issued guidance very clearly that they recognise all batches of AstraZeneca Oxford vaccine, and as well as most of the rest of Europe, and I think we're working with the Italian authorities, just both our regulator and the EMA, to get that right. Suffice to say, I also had one of those batches, and it's an excellent vaccine.
Let's go to Charlotte Nichols. Charlotte.
Thank you, Mr. Speaker. Today it was announced Australia and New Zealand have withdrawn from autumn's Rugby League World Cup, which we're proud to be hosting, citing safety concerns given the shambolic pandemic response by the UK government. The New Zealand Rugby League chief executive said, "The tournament organisers have moved heaven and earth to make this work, so it is not an easy decision, but the COVID-19 situation in the UK shows no sign of improving, and it's simply too unsafe to send teams and staff over." Will the Minister therefore commit to meeting with Rugby League MPs and officials to ensure a safe and competitive tournament can take place, with appropriate measures to protect and reassure teams and fans alike?
I'm very happy to do...
Just for the record, I'm meeting the Chief Executive in an hour's time of Rugby League. Minister.
I'm grateful to you, Mr. Speaker, and I know something that you focus on and is important to you and your constituents, of course. And I will happily do the same and meet with them and bring the relevant officials to make sure we reassure them as well.
Simon Beck.
Thank you, Mr. Speaker. Would the Minister join with me in thanking the many scientists and staff involved in developing and producing the COVID vaccines in the UK, including the Watcart employees in my constituency of Clwyd South, as their achievements have been truly world-beating and remarkable?
I'm grateful for my honourable friend, the member for Clwyd South. I would certainly join with him to congratulating Dame Sarah Gilbert and her team, and of course the team at Watcart, who I know the Prime Minister has also visited and has thanked on behalf of the whole nation.
Right, let's go to Steve McCabe. Steve.
Thank you, Mr. Speaker. Further to the question from the honourable gentleman for Southend, what does the Minister suggest a constituent of mine should do if they are planning to travel to Portugal or Italy in the next 2 weeks and they've had the Indian manufactured Covishield jab?
For the honourable member's question, the MHRA, our regulator, the EMA, and of course officials are working with the Commission wherever we spot these inaccuracies. We address them. We address them with Malta, with France now, pretty much the whole of Europe, I'm assured. As of last night, other than the Italian authorities, which we are working with, will accept the AstraZeneca vaccine from any batch, because all batches, all factories are approved by our regulator before they enter the United Kingdom.
Brian.
Mr. Speaker, you can go to the Latitude Festival with a negative test or 2 jabs. You could do it at the Open Golf last weekend with the same, yet you can't report for work in the NHS or put food on the supermarket shelves. We are rightly worried about the 3 million healthy 18 to 30-year-olds yet to get a vaccine, but put ourselves in their shoes. They see all of us get a jab and they wonder what they get in return. So I ask the Minister, Mr. Speaker, do we believe in our vaccine or not? And what is the scientific evidence to explain the difference between July 19th and August 16th when it comes to isolation for the double jabbed? The evidence.
Thank you very much, Mr. Again, my honourable friend, Member for Winchester, always asks important, yet challenging questions. The 18-year-olds can look forward to travelling to 33 countries now that have accepted double jab Brits. If they can demonstrate that from September, mid-September, if they have their jab now, it'll be mid-September, and they can go to those countries. They will be able to look forward to enjoying life clubbing by the end of September, as well in terms of their enjoyment of the Winchester nightlife. And of course, I hope I make clear to the House that giving ourselves that additional few weeks where self-isolation is probably the second most effective tool after vaccines, makes a huge difference as we transition this virus. It is not easy, but I certainly think we're doing the right thing to be able to give us the space and the time to transition this virus from pandemic to endemic status.
Thank you very much, Mr. Speaker. The app forcing self-isolation is grinding our country to a halt. Delivery drivers, shops, transport, hospitality, factories, essential public and blue light services are at breaking point. The Minister has said there would be no more exemptions to self-isolating. The Business Secretary said the same just this morning. Then, just over an hour ago, he has told the press, Mr. Speaker, not this House, that he has changed his mind. Who are we to believe, this Minister or the Business Secretary?
Thank you, Mr. Speaker. I think the Honourable Lady for South should just demonstrate how difficult these decisions are. And I would just say to her that we are working flat out in the Department of Health and the Business Department to work with business to get and reassure, whether it's the critical infrastructure that the Business Secretary spoke about or any other part of the economy, so that we can safely return to a place where we open up and open up permanently.
Redcar and Cleveland has the highest COVID rates in the country at more than 1,500 per 100,000. However, in the last 28 days, we have not seen a single death from COVID, such as the protection the vaccine provides. We need more people to get the jab to ensure our hospitalisations and deaths stay low. So will he work with me and Redcar and Cleveland Council to ensure we have the additional vaccine centres, supplies and vaccinators? And secondly, will he consider the chemical industry as part of our critical infrastructure, producing the pharmaceuticals for vaccines and the plastics for syringes for exemption from the usual isolation rules ahead of August 16th?
I'm grateful to my honourable friend, the member for Redcar, and his championing of his businesses and his constituents. There is no shortage of vaccine. I'll very happily work with him in terms of the workforce and making sure there's a resource to be able to continue to vaccinate at scale. And, of course, the industry that are delivering some of the essential products for the vaccination programme are incredibly important in this effort.
Mr. Speaker, in order to beat this virus, the government has to not only take care of its domestic responsibilities but its international ones. So can the Minister update us on what's been done to ensure vaccine supply to middle income and low income countries, and update us on the international approach?
I'm grateful for the member for Glasgow South West for his excellent question. Incredibly important, because we've pledged to deliver 100 million excess doses, beginning with 5 million immediately, and then 20 million by the end of the year, then the balance next year, as well as, of course, the AstraZeneca Oxford vaccine being delivered around the world at no profit to AstraZeneca or Oxford. I can certainly update him. We've actually sent out our first deliveries of the Oxford AstraZeneca vaccine as per the Prime Minister's pledge. And speaking to the Serum Institute of India, they are now producing not 100 million doses a month, they are at 200 million doses a month of that vaccine. So it really is an extraordinary achievement by Sarah Gilbert and her team and AstraZeneca for saving the world from this awful virus.
Thank you, Mr. Speaker. The Minister was very grateful in helping us secure the Tunstall Mass Vaccination Centre that's delivered over 50,000 jabs into the arms of people and is the City of Stoke-on-Trent's Mass Vaccination Centre. As part of the autumn rollout, where we'll be getting a third dose into the arms of many residents, will the Minister confirm that the Tunstall Mass Vaccination Centre will stay in place over the autumn and winter this year?
I thank my honourable friend, the member for Stoke-on-Trent North, and his effort in getting 116,657 jabs into the arms of his constituents and offering them that protection. I will certainly have a look at the vaccination centre as part of our infrastructure. We have a very ambitious programme to deliver. First phase, about 15 million people. Second phase, cumulative 32 million people. So we will be doing that at scale, as well as, of course, flu vaccination wherever possible.
I am now suspending the House for 2 minutes for the necessary arrangements to be made for the next business order.